Hello everybody, how are you? I am Mohammed Ahmed and your teacher here, and I will be teaching you different questions and their answers. So I welcome you on classtheta.com where we will be discussing question. So let's get on the question. Our today's question is Silent has returned to the nursing unit following abdominal hysterectomy to gather data on the Silent's postoperative bleeding. The nurse should implement which interventions? Select all that apply. Option 1, observing perineal fat drainage. Option 2, observing the abdominal dressing. Option 3, rolling the Silent to one side to view bedding. Option 4, monitoring output from the Jackson-Pratt train. Option 5, escalation of bowel sounds, especially lower quadrants. Option 6, observing for abdominal distention and presence of ecchymosis. The correct answer of the question, option 1, observing perineal pad drainage. Option 2, observing the abdominal dressing. Option 3, rolling the saline to one side to view bedding. Option 4, monitoring output from the Jackson-Pratt train. The nurse should roll the silent to one side after checking the perineal pad and abdominal dressing. This allows the nurse to check the rectal area where blood may pool by gravity, particularly if the saline is laying supine. The nurse should also observe the output from the Jackson-Pratt train. Acceleration of bowel sounds is related to return of peristalsis. Abdominal distension may occur with air in the bowels, not necessarily bleeding. Ecchymosis from the surgical bleeding would not be apparent so soon after surgery. Focus on the subject, determining postoperative bleeding after an abdominal hysterectomy. Consider the intervention described in each option and select the options that relate to bleeding, both observable and measurable. So that's the correct answer of the question. If you have any question, just leave a comment. I will be answering you as soon as I can. Thank you very much for watching the video. Please don't forget to like, share and subscribe our channel. Until next question, bye bye.